Hello, I'm Dr. Guy Yatros from Dental Sleep Solutions and DS3, and today we're going to talk about making a MyTAP provisional device for your patients. We'll talk about the indications and usages for this in just a few moments as we're making it. Maria's going to be nice enough to let us make the device on her today. First of all, I want to talk about what comes in the MyTAP kit. You can get these from Airway Management, that are the makers of it. You can get to them on pricing. It's a little over $100, best I recall. And in the kit, you're going to have an upper and a lower tray. You're going to have the little screw that holds it together. Don't lose that. I've done that before, and that's kind of a mess. You have what's called a lip guard. If you, in some cases, when you're finished, you want to minimize oral breathing, you'll want to use this. You'll have a container to hold the device, and you'll have some instructions to read if you want, but you don't need those because I'm going to teach you how to do this today. And I'm a man and I don't read instructions. So, and you also have an AM aligner. I'm not going to go through how you use the AM aligner. We have other videos for that. So we're going to get started today. The first thing we're going to do is take the upper tray, and we're just going to make sure it fits into the mouth. Which it does. Okay, then we're going to place this. As you can see, it's white when it's hard, and it's going to be get to a nice firm when it's cool again. And if you happen to mess this up, don't worry about it. Heat it up. It's going to go right back to the shape. So we're going to take some hot water pretty close to boiling, and all you need is a bowl for hot water and a bowl for cold water to do this quicker. I'm going to fill up the water. And we're going to put it in here until it turns completely clear. Okay, we're going to take that out of the hot water, and as you can see, it turns completely clear. You don't want any white on it when you go to deliver it into the mouth. Now I'm going to go ahead and put it in the mouth. Just make sure that you don't let it get doubled over, and try to get the handle in the middle, and just have the patient gently bite down with moderate pressure. Now Maria, you're going to do my work for me. You're just going to suck through your mouth like you're trying to suck through your lips. Okay, like this. Can you do this? Do that. Okay, forming that with the pressure of your own cheeks, just sucking back, and you're going to do that for about a minute. Okay, just keep sucking there. And while she's doing that, we'll talk about when we use these. We're going to use these devices in patients who happen to break their device. So that's the number one thing you need to have them in your office for, because if you're doing dental sleep, someone breaks their device, loses their device, they're desperate for something, they can leave this day for you. So that's the first indication. The second indication is going to be that sometimes patients aren't ready to spend the money on a full-fit custom device, and this is something we can give them immediately to go ahead and try out. And the third one is in cases where maybe patients don't have apnea or just snoring and want a more economical use device. So she's going to keep sucking like that, and with your tongue, form it around the inside, kind of squish it up on there. Just got to keep doing this. The number one thing is let the patient do the work for you. If you start going in there with your hands, it's going to start bouncing back and forth and not forming tightly. We're going to leave this in for about 4 minutes total, maybe a little longer, until it turns mostly white. So I don't know if you can get a close-up on that. Tell the patient don't open, to keep your teeth together nice and firm. Okay, and I'm just going to, if you can zoom in, I'm going to take it, and I'm just going to form around the teeth a little bit, making sure she's doing her job, which she is, and just keep staying biting together. The other thing we're going to do in just a moment is I'm going to take my fingers and run it across the occlusal plane to make sure none of it's drooping down, because these need to slide across each other. So that's one of the mistakes you may make, is if you let it droop down, then it'll kind of run into each other. So always tell the patient don't open. You want to hold it in place before they open, or it'll fall down and we'll have to start over again. So I'm going to tell you not to open. Okay, I'm going to support it now. Now I'm going to tell her to open. Go ahead and open. I'm going to take my fingers and just make sure nothing's drooped down. And now I'll check the lingual sides too, to make sure my patient, who's doing an excellent job here of doing this. Okay, and as you can zoom in on this a little bit, can you see it's starting to turn a little bit opaque, but not real white yet, so I'm not quite ready. So bite back down. Keep doing your job here. So we're going to give that a couple of minutes, and when it gets pretty close to white, we're going to take it out. Now, when you take it out, if you take it out too soon, it's going to fit loosely, because it's not going to have gotten in those undercuts. If you take it out leave it under too long, it's going to fit too tight. So we'll go through that in just a few moments. Okay, we're getting close now. As I look at this, it's turning mostly white. I don't know if you can zoom in, turn over towards that way, if you can see it from there. See, it's mostly white. Okay, I'm going to have her open, but again, I'm going to support it to make sure it's done. I'll go ahead and open. I'll make sure the inside seams form well. So that it looks like it's pretty close now. It's been about 4 minutes. I'm going to gently take it out. Okay, and that's what it's going to look like. Okay, it's not quite hard yet, so I'm going to put it back and I have some cold water. You want a flat bowl. See how that bowl's flat? On the bottom, if it's bent, while it cools, it can distort the actual device there. So while that's cooling, or if you don't have cold water, just set it flat on the countertop while you form the lower. All right, we're ready to fit the lower now. We're going to go ahead and take it out of the hot water. I went ahead and put it in the hot water, and again, make sure it gets totally clear. If it's any white at all on it, it may not form correctly. So give it about 10 seconds to cool down. Okay, and we're going to gently place it on the lower, trying not to double it over, which sometimes can happen if you're not careful. Okay, centered. Now go ahead and just bite down, moderate pressure, form this for us. So again, when I first started making these, I was trying to form it myself and just have the patient suck back through their mouth like this and have their cheeks form it for the first at least 1 minute or so. On the lower, it's a little more critical to get the lingual really good into all the undercuts. On the upper, it's a little more important to get the buccal into all the undercuts to make it fit tight enough. Okay, so she's going to keep doing her job. I'm keeping an eye on the watch here. After about a minute, I'm going to go back in and do the same things. I'm going to make sure that it's getting into the undercuts and pinch it a little bit as we go along, and make sure that I run my fingers over the back to make sure that it doesn't droop up in the very back. Okay, it's been about a minute. I'm going to say don't open. I'm going to hold it in place with my fingers. Now I'm going to tell her to open. I'm going to go ahead and run my fingers across the back, which they love when you do that sometimes. And I'm going to squeeze it in the interproximal. Sometimes they don't get the lingual formed well. Still setting up quite a bit here, so I'm going to have you bite down. Keep doing that. What I did there is also check to make sure that she was doing her job. And on the lingual, so on the tongue side, make sure you just squish it nice and firm. Just keep squishing it against all the surfaces along the inside of your lower teeth, please, while you're sucking through like you're sucking through a straw. Again, we're going to give this about 4 minutes total, sometimes longer. Really, it's not a timing thing. It's looking to when that becomes mostly white. The biggest mistakes you'll make, it seems like people get in a rush, they take it out, it's still half white, half clear, and then it's too loose. Okay, it's been 4 minutes or so, but what I want you to pay attention to is how white this has turned. It's turned mostly white, still a little creamy. That usually is about good. I'm going to have her open again. I'm going to hold it to make sure. I'm going to check her job on the inside, make sure there's none drooped over the back, and then I'm going to go ahead and remove it. And again, that's what it's going to look like. Kind of mostly white, still a little bit clear. But if you don't leave it in there long enough, you won't get into all those undercuts like we're showing. I'm going to put this in the cold water. We're going to go back in and try the top one. All right, we have the top ready to try in. It's nice and white. That's what you want. It's nice and hard. It's been in the cold water for a bit. Now I'm going to tell the patient, you're going to think this feels a little tight everywhere, because most patients kind of get a little claustrophobic and they feel it's a little tight. And if you set the expectation it's going to fit it a little tight everywhere, they won't tell you to start adjusting it. If it is too tight, you can put it in the hot water for just a second and it should go right back in and tease it in and out. If it's too loose, well, we can start over, heat it all the way back up, and make sure that they form it. But if you'll do it the way we showed you, most of the time it's going to fit just about right. So make sure you don't get the patient's cheeks in there. And I'm going to go ahead and just snap that in place. You can hear it snap. Okay, I'll let the patient, you want to push it in the back for me? She's a little apprehensive, I'll let her do it herself. Okay, you can see it's nice and tight on there. And that needs to fit tight enough so that if she opens her mouth it doesn't pop out. I'm going to make sure she can take it out now. Can you take it out for me? Grab it in the back, not in the front. It'll pop right out. Okay, so that's good for that one. Let's try the lower one in now. So we're ready to put the lower one in now. Again, it's been in the cold water, it's all formed. Not a thing of beauty, but it'll do the trick for us. So we're going to put it in. I'll tell you it's fitting a little tight everywhere. And if your patient's a little apprehensive, you can just have them do it. But you hear that snap? How nice and firm that is? Okay, I'm going to make sure she can take it out for me. Go ahead and take it out. I'm going to tell you it's going to struggle with it a little bit. The bottom one has to fit a little bit tighter than the top. Okay, now we're going to put it together and try the whole thing in at the same time. All right, we have the two arches here. We're just going to put them together like so. Again, don't lose the screw, and the screw has a curve to it. The curve, the convexity goes towards the patient. It makes it much more comfortable on their lip. So we're just going to take that screw, start putting it together. And we should by now have already done a range of motion and would have an idea of where we want to put this patient. So let's say we want to put her at edge to edge. That's where we determine where the starting position might be. Then we would just adjust the screw to where the lower and the upper arch seem to be about edge to edge. And there's a gauge on here that you can somewhat go by. So I've got it all together. Now I'm going to make sure she can put it in herself. All right, we've put the upper and the lower together of the MyTAP. We set it about end to end where we predetermined by doing her range of motion previously. And she's tried both arches in. So at this point, I'm going to let her try it in herself. Again, you're going to feel it's a little too tight everywhere. And we'll make sure she can put it in. And then we'll talk about cleaning instructions in just a moment. So go ahead. The smooth part goes towards the top. Just put it in on the upper and lower. And then sometimes they have to kind of push the lower one down with their fingers in the back. If someone has limited dexterity, they can even take a tongue depressor or something and bite down. And she's got it in place. You can see it's nice and firm. And if she has a husband, which she happens to do because this is my wife Maria, and she starts snoring one night, I can just reach over and turn down the volume, because this little volume control here, what I really like about the MyTAP. So that's as simple as making that. It takes us, I think it's been about 15 minutes that it takes. It should be done by your team members most of the time. My auxiliaries do this. I don't do this myself. It's a wonderful service. You can use it again for patients when they break their device. You have to have something for them then. We use it as a trial device for patients who really want to try this, but we're not sure it's going to work and they don't want to spend the money on a custom device. And then sometimes if patients are just snoring and they say, I need something now, I'm going on vacation, I'll do the sleep test later. We'll do these initially sometimes because at least we're treating the patients while we're getting the sleep test. So you've got to have a custom device for your patients, but you also need a temporary device. And the MyTAP's the one we use these days. It's a great service. You're going to want to make an AM aligner and go over that with them. And then the cleaning instructions for this are fairly simple. You want to brush it with a toothbrush, keep it clean. You want to put it in to dry it off after you brush it. Put it in the container, but leave the lid open and keep it away from the pets because the dogs love to get a hold of this, and even cats. So leave the lid open, will keep it from getting all mildewy smelled. And they can clean this with disinfectants of like denture cleaners once every week or two is needed. One key note is to tell the patients not to use hot water for obvious reasons. It will heat back up and remold. So once again, well, one more thing I want to mention is you can use the lip guard, and this is for patients who we're really trying to encourage nasal breathing. You put that on in between the nut and the lower, and it'll encourage nasal breathing. So that comes with each kit now. So once again, I'm Dr. Guy Yatros from Dental Sleep Solutions and DS3. Thanks for watching this, and go out and make one of these devices on yourself or your friend or one of your team members. You're going to find how much fun dental sleep medicine is and how rewarding it is. Thanks a lot.